In the pain clinic where I work, 21% of the patients with chronic pain smoke cigarettes. This is 1 in 5 people with chronic pain. Why do they smoke? If smoking makes pain worse and has so many bad health consequences. In this video, we will explore some reasons why people smoke, and I will suggest some strategies for people to quit smoking. So stay tuned. Let's talk about smoking and pain. Most people don't know that smoking cigarettes predisposes a person to have more chronic pain, like low back pain, rheumatoid arthritis, headaches, and neuropathic pain. People with chronic pain who smoke have higher pain intensity, further disability, and increased depression than people with chronic pain who do not smoke. However, most people also don't know that nicotine has analgesic properties, which means it's a painkiller. What? Did I hear it right? Yes. It's an interesting paradox here. Nicotine decreases pain and nicotine increases pain. Scientists show that in people who do not have chronic pain and volunteer to an experiment to provoke pain, they will report less intense pain if given them nicotine before the experiment. This is more obvious in men than women. This experiment shows that nicotine is an analgesic. It occurs mainly at the brain level when the nicotine activates the nicotinic acetylcholine receptors, or NACHR, which results in the release of opioid and norepinephrine in the brain. This will also block the pain activating pathways and will activate the pain inhibitory pathways in the pain system. But then, why do people who smoke cigarettes have more chronic pain? Well, there are many different mechanisms for this to occur. First, there are 4,000 substances in a cigarette, and when people smoke every day, these substances will damage many body tissues and organs, like impaired bone healing, wound healing, causing osteoporosis, disc disease. The carbon monoxide will lead to poor oxygenation to organs. Second, is the deregulation of the pain system. Neuroplastic changes leading to nociplastic pain, and see another video that I made where I explain nociplastic pain. Third, they also interact with opioids, causing cross-tolerance and altered breakdown of the opioids. Fourth, nicotine causes altered mood. People who smoke are more depressed. Nicotine increases the hormone norepinephrine that increases blood pressure, but also affects mood and anxiety. And fifth, the nicotine in tobacco will lead to nicotine dependence. Nicotine will reach the brain within a few seconds after the first inhalation. It will release dopamine, which is the neurotransmitter of pleasure and reward. Also, nicotine withdrawal symptoms are very severe. Now we know that smoking leads to more pain, depression, irritability, and is very addictive. But these are not the only bad effects of smoking cigarettes. They also cause high blood pressure, stroke, heart attack, stomach ulcers, poor appetite, impotence, infertility, asthma, emphysema, bronchitis, bad breath, altered taste, stained teeth, gray skin, wrinkles, weakened bones, arteries clogged that can lead to amputations, and various types of cancer. I know many orthopedic surgeons who would not operate on someone who smokes cigarettes. That's because smoking impairs oxygenation delivery to the tissues, including the bones, impairing the bone healing, wound healing, and could contribute to complications after surgery, such as infections, poor healing, and pain. It's unbelievable, but there are 18 billion cigarettes that are smoked every day in the world. So why do people with chronic pain smoke? People smoke for a variety of reasons, and that's why it's so hard for them to quit. It just takes a few days to develop a tobacco addiction, so the best option is not to start. Once a person starts smoking, their body will start opening up those nicotinic acetylcholine receptors, and they will crave their nicotine. Absence of nicotine causes irritability, anxiety due to the dependence, and these cravings will be all they can focus on until they calm down those receptors. Think of addiction like the young birds in the nest screaming to get food from the mother bird. The nicotine receptors are screaming to get their nicotine, and they will only stop when they receive what they want. There is a questionnaire that people can answer to know how bad their nicotine dependence is. The Fagestron test for nicotine dependence has a number of questions that, depending on how you respond, it will show that if a person has more severe or less severe nicotine dependence. Some of these questions are like, how soon after you wake up do you smoke your first cigarette? Do you find it difficult to refrain from smoking in places where it's forbidden, like churches or library or cinemas? Which cigarette would you hate most to give up? How many cigarettes per day do you smoke? Do you smoke during the first hours after waking up, during the rest of the day, then during the rest of the day? And do you smoke even when you are ill enough to be in bed most of the day? A person that scores 5 or more indicates a severe, significant dependence on nicotine. But nicotine dependence is not the only reason why people smoke. Sometimes it's just a habit of holding a cigarette, to keep something in the hands, or simply pressure to watch the smoke, to socialize with friends, to give a lift, or to take the mind off the worries of life. Some people keep smoking because they don't want to gain weight. Well, if they quit, it's interesting that the weight gain is between 2 and 5 pounds, but the health benefits of quitting are so much higher than the risk of gaining just 5 pounds. Lastly, for people with chronic pain, one of the reasons they keep smoking is because pain is their motivator. Some people will endorse pain-induced desire to smoke. They will say, my smoking is extremely related to my pain. Instead of rubbing my knee, I'll go smoke a cigarette. If I have a flare-up, I'll go for a cigarette. Some people will endorse smoking for pain coping. For example, like a distraction. I'm thinking of a cigarette, puffing it, and lighting it, and holding it, so it diverts me away from the pain. Some people will say smoking is a great distraction too. Some people report that opioid increase the urge to smoke. I have seen people saying, when I was on opioids, it was making me like a chain smoker because of the interactions that we have in the brain, that opioids and nicotine increase the codependency. So those are the reasons why some people with chronic pain will be smoking. So now let's talk about quitting smoking. There are many options for people who want to quit smoking. You should talk to your doctor if you are interested in quitting. Remember that you may fail many times, but if you keep trying, one day you will certainly be able to quit forever. Don't give up. There are many resources and options to help people who want to quit. Nicotine replacement therapy to reduce the cravings. They come in various forms like gums, lozenges, patches, inhalers, and mouth sprays. The patch is more long-acting NRT, while the others are more like short-acting and help reduce the breakthrough cravings. E-cigarettes and vaping are currently being investigated by Health Canada as alternative methods for quit smoking. Medications to block the effects of nicotine, such as varenicline, or to make the smoking less pleasurable, like bupropion. Also, it's important to know your triggers and avoid them, like alcohol, coffee, meals, stress, being around smokers, parties, breaks, watching TV, driving, and so on. What if you have cravings? Remember the 4 Ds. The first D is delay. Delay the craving. The craving rarely lasts more than a few minutes, and do some activities to pass the time. The second one is to distract your mind. When craving hits, stop what you're doing, do something else. The third one is deep breathing. Inhale through your nose, hold it for 5 seconds, slowly breathe out through your mouth, count to 7, and repeat this a few times. And the fourth D is drinking water. Actually, it helps. It helps to reduce the hand-to-mouth behavior. It helps change the taste in your mouth and will actually reduce the craving. Try sipping slowly, holding the sip in your mouth for a few seconds. And what to do if you're having withdrawal symptoms from the nicotine? Well, anxiety. Anxiety is very common. Go for a walk, do deep breathing, do some exercise, and try to drink less coffee. Another symptom of withdrawal from nicotine is fatigue. So it can take up to 4 weeks for your energy level to return to normal, and try getting more rest, exercising more, drinking lots of water. Another one is difficulty concentrating. So try to eat small amounts of food every few hours instead of 3 big meals. Another one is feeling sad, feeling depressed. Try to get support from friends, family, or support groups and talk to your doctor. Other people may feel anger. So talk to people close to you, accept your emotions, vent your feelings in a safe environment. Other people may have increased appetite. Try to eat smaller amounts more often. Choose healthy snacks such as carrot sticks. Other people may have constipation. Try to increase the amount of fiber in your diet, drink more water, and reduce the caffeine. And some people will have insomnia. Try relaxation exercise before bedtime, reduce the caffeine during the day. And don't forget, there are many resources for people who want to quit smoking. Many support groups in Canada, many websites online. I will describe many of those resources in the description of this video below. Now, please remember that this video is not intended to provide medical advice. It's just for educational purposes. If you think you have nicotine addiction or chronic pain that is associated with smoking, please consult your doctor to get medical advice and a treatment plan for you. If you like this video, don't forget to like it, to subscribe to this channel, and to turn on the notifications so you can be alerted when I post new videos. I also tweet, I have a Facebook page and an Instagram account. You can contact me there, asking questions, making comments, and suggesting topics for new videos. Thank you for watching. Bye!